This is the Emergency Medical Minute, brought to you by HCA Health One.
All right, well, good morning. Happy Monday, everybody. Yesterday, we had a cardiac arrest. It was kind of a routine ventricular fibrillation arrest that was defibrillated by EMS, and the patient did get ROSC and went into the ICU. But one thing that I did want to talk about relative to that was a recent study. It was an interesting study because in the Netherlands, they have a very robust volunteer first responder system for cardiac arrest. So when a call to the essentially emergency system goes out for a cardiac arrest, people who are trained volunteers in the area get an alert on their phones and they respond. And there's a very large network of AEDs. So people grab an AED and they get to the person usually before even, a good EMS system. And they have very good tracking of this. So what they did in this study was look at the time from a ventricular fibrillation arrest to the first cardioversion and look at, does time, even minutes, affect the rate of successful kind of getting person out of ventricular fibrillation and survival. And what they found was that if it was very quick, like under 3 minutes, people had very good survival, like 75%. For each minute that there was a delay in getting that first defibrillation, the rate of survival dropped by about 6% per minute. So, and then by the time they got to about 10 minutes or after, that rate of survival was down to about 33%. So pretty dramatic. And you think like, 10 minutes to shock, that's pretty good. But even those first couple of minutes really can drop your survival rate significantly, 40-50%. We don't quite have that system here, but being someone who's trained and the first responder, getting an AED, being the first person on the scene and getting a first defibrillation in these probably VFib, VTach arrests really does matter. It's kind of interesting stuff and things to take and a public health message as well. Any questions? Thanks, everybody.
This has been the Emergency Medical Minute. Thank you for listening, and thank you to HCA Health One for their financial contributions. Support from them and from listeners like you helps us achieve our goal of spreading free education to the masses. If you'd like to help, please donate. Follow the link in our show notes. Thanks for listening.